On October 8, 2005, a tremendous earthquake hit northern Pakistan, killing 73,000 people and leaving 3.5 million homeless. Despite an unprecedented relief effort by the government and international organizations, enormous challenges remain in meeting the survivors' needs, especially for health care. With the support of UNFPA, the United Nations Population Fund, dozens of female health workers are ensuring that women in even the most remote earthquake-affected areas have quality reproductive and maternal health services. When the earthquake struck Muzaffarabad, Larmijan's house collapsed. She suffered a serious back injury and her son, 18, was killed. While most survivors returned to their home villages in the months after the disaster, Larmijan and her family had nowhere to go. She and her husband came from Indian-administered Kashmir 15 years ago. Now they live with their 4 young daughters in a tent camp for refugees. Larmijan, who is over 40, got pregnant after the earthquake, hoping for another son. During her pregnancy, she had regular prenatal visits with a female doctor and a midwife, the staff of a mobile clinic provided by UNFPA. When the time comes for delivery, Larmijan expects to give birth at the Ames Hospital. The maternity ward, fully equipped and staffed with UNFPA's support, is experiencing a baby boom. UNFPA was one of many aid groups that responded to the 2005 crisis in Muzaffarabad in Pakistan-administered Kashmir and Mansehra in Northwest Frontier Province. Working in partnership with the government, the fund moved quickly to establish and equip emergency medical facilities throughout the affected regions. In line with its mandate, UNFPA's principal focus was to enable pregnant women to deliver safely. As relief efforts shifted from emergency response to reconstruction, prefabricated metal buildings replaced medical tents. In the months following the disaster, UNFPA erected and staffed 34 maternal and child health facilities in the hardest-hit areas. These range from small basic health units and somewhat larger rural health centers to a 30-bed field hospital maternity center. A fleet of vehicles carry portable clinics and medical staff to remote mountain villages and refugee camps. The vehicles can serve as delivery rooms when the need arises. After a long drive up a mountain road to Mastana Gali in Pakistan-administered Kashmir, staff take only a few minutes to set up the clinic. Word of the team's arrival spreads, and soon there is a small crowd of patients seeking care. Many villagers are seeing a doctor for the first time. Dr. Sheila Nawaz and her assistant treat patients for a variety of ailments related to the harsh living conditions.
Unhygienic conditions are very common here.
So dysentery,
Scabies patients mostly, skin diseases, gastroenteritis, and anemic. Most of the females are anemic.
Yeah.
For women without access to good maternal health care, pregnancy and childbirth are always dangerous. Nasima is 2 months pregnant. Dr. Nawaz gives her a prenatal exam, guidance on nutrition and health, and some medicine. The doctor tells her that when her baby comes, she should go down to the nearest health center to deliver safely. Many women are following such advice. Nazia, age 19, was referred to the Hashian Bala Hospital's maternity center for a sonogram. She gave birth to her first child just a year after the earthquake, which buried most of her family in a landslide near Shakar. Female doctors and midwives at the UNFPA-supported health centers are delivering lots of babies. They live at the health centers and are ready round the clock to confront life-threatening complications.
He had miscarriage and they are bleeding and they can't go for Muzaffarabad and they'll bleed more, they'll collapse in between, they could die.
That's 35 women whose lives you saved in just one
In this time.
less than 1 month.
Less than 1 month.
My working time is 24 hours. If there is some delivery come, I will conduct it at any time, even at 2 a.m. in the night.
We are normally doing 60 deliveries in a month, 50 to 60 deliveries in a month, including thousands, 2,000, 3,000 OPD in a month. Doing family planning over here, counseling the patient for family planning, and doing DNCs for miscarriages, dealing threatened abortions, incomplete, complete abortion, dealing all the things over here.
As word of the health centers has spread, more and more people have started coming. Most of the clients have been severely traumatized by the earthquake and poor living conditions.
I think they need more counseling than medicine. Trying my best to counsel them for how to take medicine not only, but how to, improve their lifestyle, how to avoid stresses, and how to go for the well-being of them and their family also.
At the Chattar Plain Rural Health Center, Nargis, a 32-year-old mother of 4, came to see Dr. Simi Khan.
She came over here to check her baby, and after that she asked from me about her problem. She's having three daughters and 1 son. So now she wants family planning, which is for the long duration, and that's why I just show her the different methods of family planning which we are having over here. And today I will do this procedure.
They've mentally suffered a lot. I mean, the people coming to me, they said, especially women, they said they had children, 2 or 3, they all died in earthquake. So they are looking for conception now.
Whenever a patient comes, if she is multi-patient, having many children, 4, 5, 6, we are actually educating them that your family is complete now. If you are pregnant, okay, give birth to this baby, and now you have to go for family planning over here. We are giving free service for all type of family planning, and if she is primary, we are dealing her how to you have to maintain your food, you have to take healthy diet, you have to take healthy sleep, and how to maintain your blood pressure, how to stay away from diseases, and we all educate them from here.
It will take many years to repair the terrible damage caused in 2005 and rebuild the homes of the displaced.
She says, yes, I wish to, but I don't have those resources now. We are broke and we cannot make another house right now.
In the meantime, it is critically important to provide good health care for the survivors, including women facing the risks of pregnancy and delivery. Thanks to the dedicated medical workers supported by UNFPA, many of those women now have access to better care than they had before the earthquake.
We are here.